I will start to ask you. First of all, I'd like to thank you for contribute quite a few article review and also research article, and you organize a special edition. That's very helpful for us to understand that mostly movement disorder, and especially your in the functional motor movement disorder, which is a very important part of functional neurological disease, because from my understand, mostly that functional neurological disease is come from the motor symptoms or movement involuntary movement symptoms. You have this field for many years. What, in your opinion, how you can move this functional neurological disease into a new that field if for the neurology specialist, it's very hard, sometimes very difficult to distinguish it from real neurological disease. Not only just for subjectively, and also any objectively, or any new technology can detect them, to examine them, or to distinguish them from each other. What I want to learn more from you. Okay, please, Mark.
Sure, I would be happy to talk about this important topic. Just to say a little bit about my own background in this regard, I have been interested in movement disorders most of my career.
Yes.
And my interest has been in the physiology, the basic pathophysiology of different motor disorders that I have studied over the years. I've been interested in Parkinson's disease, in different types of tremor and dystonia, a whole variety of different types of disorders. And, and in recent years, as you pointed out, I've been interested in functional neurological disorders. I began with my interest in functional movement disorders, but the field of functional neurological disorders is actually very broad and consists of almost all types of neurological symptoms. The most common type of functional neurological disorder is actually functional seizures. The second most common are different types of functional movement disorders, but then also functional sensory symptoms. People can have functional blindness, functional anesthesia, also functional cognitive disorders. There's all sorts of types of functional neurological disorders, and I think it's important that these always be kept in the differential diagnosis. I think that it's also important to say, perhaps in relation to this particular journal, that functional neurological disorders can present at any age. I have seen patients who are very young, children. I've seen, and I've also seen people that are in their 80s that have presumably not had any problem before, but develop a functional neurological disorder when they're older. So in relation to age, it spans the entire spectrum of different types of disorders. I've also seen functional neurological disorders in people that have neurodegenerative disease.
So, I see.
So just because you have a neurodegenerative disease doesn't mean that you can't come down with a functional disorder too. I think that functional symptoms are a relatively common part of neurology, and it's very important for people to understand them in general. So I think that the important thing to recognize is the fact that they are very common, that they can present at any age by themselves or in conjunction with any other type of disease.
That's great, because in the clinical practice, sometimes we see some patient with depression, they want to mask as a dementia or psychological disorder. My question is, if you use imaging, functional imaging, or that electrical recording, even the sleep, recording, or that molecular, the PET scan. And can you see any abnormality in the functional neurological disorder? You can detect them. Sometimes it's very hard, for the clinical sentence. But if you have something, objectively measurement, that would be grateful. What's your opinion about this?
Right. This is an important question, of course. Let me start out by saying that functional neurological disorders are real neurological disorders. They aren't not real. They are real diseases. There is a problem with brain function in these people, and it causes a great deal of distress, and it's not a voluntary problem. It's just like any other just like most other neurological problems, these are things that people don't necessarily want. They can just appear for various reasons. Now, there is a brain dysfunction in the patients. People that have neurological symptoms will have them because the brain is malfunctioning in some way. And the question is that you raise is, can you identify them? Now, there's been a lot of work in recent years looking at neuroimaging and looking at things like EEG studies. And on a group level, there are clear abnormalities that have been identified. One can see abnormalities on structural, functional MRI imaging. You can see abnormalities in functional MRI imaging. There are abnormalities in EEG that can be defined. And the issue when you're facing an individual patient is, can you use this information to identify a patient with good sensitivity and specificity? And this is always a confusing issue when one reads the paper that says that there's an abnormality in MRI, for example. Can you use that on an individual patient? Now, I think that at the moment, that's not really possible in general, but I think that the situation may well evolve. It's a relatively young field in terms of trying to understand the pathophysiology. So there still are not as many studies as we could have. There are many more that can be done. And I think that as we do more studies, we will probably come up with methods that are more specific and sensitive. In our own laboratory, the main attempt that we've made in this regard is to use functional MRI imaging. And we have been able to identify patients with functional movement disorders compared to healthy controls with an 80% accuracy just using functional MRI.
I see.
So I think that that's as good as some tests that are being used at the moment for various other things. But I think that we do certainly need to do better. And I think that the understanding that there's a functional disorder in the brain will help us identify what abnormal functional pathways that we can define that will help make the diagnosis in individual patients.
In China, that sometimes if we suspect this patient functional neurological disorder, we usually refer to psychological department for them to give something psychological care. How this? My question is, if we identify them, this group of patients, how to manage them? Sometimes we don't have any drug, any medication to treat them. So just psychological consultation, or what do you think? Anything new in this field?
Okay, so the first point to make is that neurologists have to make the diagnosis.
Yes.
There is no way that a psychiatrist can make the diagnosis or a psychologist can make the diagnosis. The neurologist has to make the diagnosis.
I see.
The patient presents with a neurological symptom or neurological symptoms, and neurologists are trained in the differential diagnosis of neurological symptoms. Psychiatrists are not trained that way. They are trained to understand psychiatric symptoms. So it's important that the neurologists make the diagnosis. Then when the diagnosis is made, then the neurologist can decide what the best therapeutic avenue is. And there are multiple ways that can potentially be done depending upon the individual patient.
Mm-hmm.
There are some patients that would be appropriately referred to a psychiatrist, appropriately referred to a psychologist, but some of them should be perhaps referred to an occupational therapist or a physical therapist. But there are many patients that would have their primary management from the neurologist themselves. Because, again, it's a neurological problem with neurological symptoms. And I think that the neurologist has to be in charge of the management, even if the neurologist isn't doing all the primary management themselves. Now, in relation to you had raised the issue of drugs. So in relation to drugs, it might well be that there are some patients that would be appropriately managed with drugs. And the reason for that is that there's a high comorbidity of anxiety and depression in these patients. And if there is identified anxiety or depression, then I think that those can and should be treated with pharmacological mechanisms, as well as perhaps referral to a psychologist or a psychiatrist. So I think that one has to have a good sense of how to treat an individual patient. It shouldn't be by rote, because every patient is different. It's a complex disorder, like many things are in neurology, and it has to be thought carefully as to what the best approach to therapy would be.
That's grateful. For our journal, we are focused on aging and neurodegenerative disease. What do you think? This is, I think, is a broad, also interesting topic in this journal. We want to get your advice, idea, how to promote this journal to a high level, because there is a lot of competition in aging, a lot of competition in neurodegenerative disease. This is our journal is a compilation. And what do you think? How to make this journal become distinguishable and also identified by international, national, professional to for their contribute the paper or read the paper or that cited this paper. I want to get your opinion about this. Yeah. Mhm.
Okay, so sure, I'm very happy to comment on that, and I can make a link perhaps from our discussion of functional neurological disorders to the topic that you wanted to discuss now. I think that aging is an important aspect dealing with neurological disease. The brain is not stable. The brain is constantly changing over time. And one of the things that we've learned about functional neurological disorders is that functional neurological disorders have a very important predisposing factor to them that relates to early life. So there is a sort of genetic background and the influence of things that happen to people early in life that will change the brain to some extent and make them prone to other disorders later in life. So it's important to understand how the brain develops at first because it's a predisposing factor to things that happen later, but the brain then will continue to evolve over time. And it will have important changes later in life as well as early in life. And those changes that are occurring later in life interact with other pathological processes. And those interactions between aging and other processes that we refer to as neurodegeneration are very critical for the understanding of an individual person. So I think that there are a lot of journals that would deal with different aspects of this, particularly neurodegeneration is a popular topic at the moment. Aging to some extent is a popular topic at the moment. But this journal is looking at the interaction between the two. And I think that this interaction is really important. And it is important in relation to the way the brain is at any particular time. As a result, for example, of early development, which will then predispose the brain to aging changes later, or to changes in aging associated with neurodegenerative processes of various kinds. I think that's where the journal can succeed by emphasizing this important interaction, which is not necessarily the focus of other journals.